Okay, so we're gonna do traps collective first. So your patient's seated and you're gonna ask them, can you bring your shoulders up to your ears? Perfect, so they have full range of motion, so they're at least a 3. So go ahead and do that again for me. Hold it there and don't let me break you out of it. Excellent. If the patient was unable to do that, the gravity eliminated position will be prone on their stomach, and then ask the patient to lift their shoulders up towards their ears. Great. Now in this position, we'll show you how to isolate the traps as well. So if you can bring this arm up to about eye level. Okay, good. And you only need to do one, you can relax that one. And go ahead and lift this up towards the ceiling for me. Great. I'm gonna ask you to hold that position. I'm gonna place my hand on your opposite shoulder blade. Hold that and don't let me break you out of it. Excellent. So that's lower traps, coming straight out at 90 degrees of abduction, same process. Hold that position. Excellent. And then isolation of upper traps, same process as well. Great. There is no gravity eliminated for isolation of those. Okay, if I can have you, let's go ahead and stay here actually. So we'll do the latissimus dorsi with the teres and the, it's not on my paper though.
Posterior delts.
And posterior delt collective, those 3 together. So patient's arm is down at their side and you're gonna have them go up into extension. So she has full range, relax. Do that one more time for me. Hold it in that position and don't let me break you out of it. Great. If you want to isolate just the latissimus dorsi from that, I'll have her shrug her shoulder up towards the top of the treatment table. I'm gonna ask you to hold that. I'm going to pull down towards your feet, but don't allow me to. Excellent. Okay, so now we're gonna go into the middle delt and supraspinatus. So if you could sit up for me. I'm gonna demonstrate these from behind so that you can see, but normally you would be in front of the patient to do this. So we're gonna do the mid delt, so it's abduction. Can you bring your arms all the way up and back down? Excellent. Bring this arm up to about 90 degrees. Elbow can be straight or bent, your preference. This hand can stabilize on the same shoulder as long as it's not over the muscle belly, or the opposite shoulder. I prefer same shoulder. Distal humerus is gonna be a resistance. Hold this, don't let me break you. Excellent. If the patient did not have full range of motion, gravity eliminated position is snow angels. Patient is supine, and I'll bring the arms up overhead and back down. Excellent. We're gonna do anterior delt now. So if you can sit up. Can you raise your arms straight up over your head? Perfect. And can you do that again and stop halfway? Again, same hand positioning as for middle delt for stabilizing. So hold this position, don't let me break you out of it. Excellent. If the patient did not have full range of motion, I would have them sideline on the opposite shoulder. I would then carry the weight of the limb and ask them to go ahead and raise up over their head for a 2. Excellent. And we are now going to do the internal and external rotators of the shoulder. So patient will be prone and scooch towards the edge of this, lateral edge of the table. Abducted to 90 degrees, elbow is bent. I'm just gonna have her go ahead and perform the motion in both ranges at this point. Excellent. So I'm going to put her into the position and try to break her out of it. So for external rotators, I'm gonna go ahead and place her up into external rotation, instruct her to hold that position and not let me break her out of it. Excellent. Internal rotation, the reverse. This is bad hand placement. I would move my body there, but excellent. If for some reason she did not have full range of motion against gravity, I would ask the patient to take their palm, turn it in towards the table, and then turn it out. So we're looking for external when it comes up. We're looking at internal when it comes down. That would be your 2. Okay, biceps. Patient is seated on the table. Did I forget one? Serratus anterior.
Yeah.
And rhomboids. Okay. Serratus anterior, we forgot about that guy. So I'm gonna ask the patient to go ahead and touch the bottom of my hand. Excellent. Can you do that one more time for me? Hold that position and don't let me break you out of it. Great. Gravity eliminated would be patient supporting the arm on the table, punching forward. Sorry, flip again. Rhomboids. So arm is internally rotated behind the low back. Ask them to put the palm up towards the ceiling and hold that position. I will stabilize on the opposite scapula. Then I'm gonna go ahead and pull out and down towards the table. Excellent. There is not a gravity eliminated position for that. Stay here and let's do posterior delt. Yeah, so posterior delt, I'm gonna have the patient horizontally AV duct. So can you go ahead and form the motion? Excellent. Go ahead and do that one more time. Stabilize same shoulder, distal humerus, apply the pressure. Excellent. If patient did not have full range of motion, seated, arms supported on the table, horizontally AV duct for 2. Stay there. Tricep, and then we'll do back.
Sure.
Triceps, patient is stabilizing hand in the antecubital space. I'm gonna ask the patient to go ahead and extend their elbow fully so the forearm is an extension. Come back down. Hand again, and I should do it here so you can see.
Yeah, I was gonna request that.
In antecubital space, go ahead and kick out one more time. Bend slightly, hold that position, don't let me break you. Excellent. Again, gravity eliminated, supported on the table, looking for the extension. Pec major. Action is horizontal adduction. Ask the patient to come across the body. They can perform the motion. Excellent. So you're gonna go ahead and do that again. Stabilize on the opposite shoulder. I'm gonna grab in the antecubital space and draw down towards the table. Hold that, don't let me break you. Excellent. If the patient did not have full range of motion, arms supported on the table, coming across the body. Biceps. Okay, patient is seated. You're going to ask them to perform elbow flexion. Perfect. Now I can test biceps, brachioradialis, and brachialis. So with palm up, come about halfway, a little more than halfway because you don't want to test it exactly 90 degrees. Stabilizing will be on the olecranon. Resistance will be at the distal radius and ulna. Hold that position, don't let me break you. Excellent. Now turn your palm in. Same thing, brachioradialis. Turn palm down. Same thing, brachialis. Gravity eliminated, arms supported, looking for the elbow flexion motion. The wrist. Okay. Wrist and supinators and pronators, right? Okay. Supination and pronation can be seated. And you're going to, again, put the patient in the position, attempt to break them out of it. So can you turn your palm up? Can you turn your palm down? Excellent. Go back to neutral. I'm going to do the hand-shaped position. I'm going to put her into supination. Tell her to hold that position. Don't let me break her out of it. Testing supinators. Put her into pronation. Hold the position. Don't let me break you out of it. Excellent. If the patient was unable to do against gravity, the 2, can you support this, either or? Yep. This elbow with that hand and wave. Supination, pronation. And patient would be seated in a chair for wrist flexion and extension. So arm is over the edge of the table so that everything is supported. So wrist extension and flexion. Extension first, so they would draw the wrist up so we know they have full range. Go ahead and do that one more time. Stabilize on the lateral aspect of the forearm. Hold that position. Don't let me push you down. Excellent. Note your resistance is across the metacarpophalangeal joints, not your phalanges. Turn in your palm up, bring your palm up, hold that position as well, and don't let me break you out of it. Gravity eliminated for both would be the arm supported by the table, performing flexion and extension.
Is that it?
That's it.
Thanks.